The Campaign for Life and Breath is an effort to purchase 2 baby incubators and 1 ventilator for the intensive care unit at Kootenay Lake District Hospital.
Hi, I'm Lonnie Lang and I'm a volunteer for the Kootenay Lake District Hospital Foundation. I joined the foundation because I feel that the hospital is a really important part of our community. At some time in our lives, everyone is going to make use of it, whether it's yourself, your family, or your friends. And as a volunteer, it's very fulfilling to work for the foundation. Right now, we are working on a campaign called the Campaign for Life and Breath. We're trying to raise funds for the hospital to buy 2 baby incubators and a ventilator. These are immediate needs and they can't wait till tomorrow. We are appealing to everyone in the community to chip in and support us in helping to raise the funds for this. The equipment that we have now is becoming outdated.
The goal of the Campaign for Life and Breath is to raise $69,000. Imagine giving life to newborn babies who come into this world premature or have to struggle through a difficult birth.
In our nursery environment, we're required at times to look after very sick babies. In the Lower Mainland, they would normally be transported immediately to Children's Hospital. However, we can sometimes have up to a 4-day wait until we are able to transport to Children's Hospital. This has brought us to the place of requiring equipment that is at the same standard that Children's Hospital uses so that we can, in effect, do trauma care right here at Kootenay Lake Hospital. One of these things is the new incubators, and they allow us to not only control by the skin temperature and air temperature, but they give feedback from the baby to control their own environment. This was not possible with the old style incubators, which were very basic in their design and were possible to look after infants that were slightly sick, but really sick babies require a higher standard of technology to meet the standard of health care that's required in those circumstances.
Consider lifting the stress and effort of breathing for people whose heart and lungs need help to rejuvenate and become strong.
One of the problems that we do find is when we have to send our patients out to Vancouver, that it can be a very trying and traumatic experience for the patient as well as the family. We have to call in the RC Rescue, who do come in with their paramedics and pick up our patients. It can be very costly to the family. There's a lot of unknowns there, and as I say, it can be very traumatic. They come in, pick up the patient, swoop them away to Vancouver. They could be there for, actually, when we send them, we don't really know how long they're going to be there, or the outcome. With having the ventilator here, that we can try these different modes to try to wean our patients, then we could save those patients from having to go through that experience. I'm actually not trying to scare the patients that do end up having to be transferred, because we do try to make it as less traumatic as we possibly can. But the family does go through a lot. It's a very trying experience to have to send your family member off to another center and not really know what's going to happen.